This is Duke University.
Good afternoon. I think we're ready to begin our next portion of the conference. So it's my honor to introduce our third and final keynote of the day, Sloan Rachmuth. I think based on especially the last discussion, but what you heard all day, what you're going to hear from Sloan is very well timed and extremely relevant. Sloan is the co-founder, along with her husband, and chief vision officer for HealthyMe, which is a startup company based here in Durham, whose goal is to scale clinical obesity treatment using interactive technologies such as mobile phones and the web. Sloan is currently a PhD candidate in media psychology at Fielding Graduate University at UCLA, and her current research is in health behavior change and the development and uses of e-health intervention programs. She has a double major in psychology and legal studies from Harvard University, and while she was there, she conducted behavioral research at Harvard Medical School as well as MIT. In addition to her academic experience, she worked for Fortune 100 medical device companies, including Stryker, Smith & Nephew, and Covidien in both sales and management capacities. I had the pleasure of having dinner last night with Sloan along with a few of my peers, and I think we were, one, impressed with her track record and her academic experience, but I think a lot of us were just blown away by her personality and her passion for her new startup. So without further ado, Sloan.
Thank you very much. Hi. Thank you. Can you guys hear me all right? I tell you, I could hardly stay in my seat after the last panel. It was fantastic. I don't know if you saw me kind of waving my hand saying, I might have a solution. But I want to introduce my company, HealthyMe. What do we do at HealthyMe? We are actually trying to address the obesity epidemic by scaling the clinical treatment of obesity via mobile phones, any mobile phone, not just a smartphone, and the web. So we actually have a mobile platform that deals with behavior modification, and this is what I call digiputics. So we've talked about medication that targets specific receptors to address the obesity problem. We've talked about medication that helps mitigate the effects of diabetes as well. We've also talked about medical devices that can help. And so our concept is digiputics, and I'll explain to you more about what that is. All right, Healthy Who? This is what we do. We deliver scalable treatments that can be used with a doctor and a patient together to address obesity. So it sort of marries the consumer end of obesity treatment and the healthcare end as well. I feel it's important to kind of tell you a little bit about who we are, who the team is, because when we talk about behavior modification, you need to have a little bit of credibility because everyone throws that term out, but we're actually researchers here at HealthyMe. My co-founder is in the audience, the CEO. He's a Harvard MIT biomedical engineer, and so he is the artificial intelligence expert on the team who does the algorithms that go into making HealthyMe what it is. I'm a CVO of HealthyMe. Everyone asks me, what is a CVO? It's the person in the organization that does the 5% that the CEO doesn't do and gets to go out and speak, and that would be me. I'm the Chief Visionary Officer here at HealthyMe. But I've also, for you in medical device and pharma, I've carried a bag before. So I'd sold medical devices, actually orthopedic implants for Stryker, Smith & Nephew in New York City. So I've been cussed out by the best surgeons in the world and had things thrown at me in the OR. That's why I'm in a startup. I can kind of handle that. And my most recent position was at Covidien. I handled the entire Northeast for a neurologic product and managed 46 sales guys. So I've kind of carried a bag. I've also had 15 years of experience in treating obesity, and I'm only 25. So I've really done a lot. And I'm tired, let me tell you. Now, all right, to the entrepreneur people in the crowd, I understand that there's a few of you guys from the program. I just wanted to tell you, my CEO and I left the corporate world, and when you do that, and if you're thinking about doing that after getting your MBA, let me give you a few pointers or warnings. Think about it as steady income. We haven't had a steady income in quite a while. We're completely bootstrapped because we believe in this so much, but there are some prices to pay. Bye-bye expense accounts. So I traveled in Boston, New York City, etc. I had a $120 per diem for meals, and now it's just appreciative to get the free Diet Dr. Pepper I got out here. That was $1.79 anywhere else, so I was very appreciative of that. That's great. Five-day work weeks, 8-hour work days gone. But I think the most painful one, and because I'm at Duke, I know you guys get this, you're no longer the smartest person in the room at a given time. So your ego really takes the hit when you're doing a startup. You will not believe how dumb you can feel by the wisdom that's shared with you via your customers, via your advisors, via your board. Every day, you know, we're told, this is wrong, you're wrong, why do you think this, etc. And, you know, being Harvard grads, we're not used to that, so we've been taken down a few pegs. So if you're thinking about doing a startup, be prepared for that. And since I'm at Duke, I know you guys know what I'm talking about. The main question is, are we nuts? Give all this up for a startup, are we nuts? I don't know, but you can tell me at the end of the presentation, because I think we're making a heck of a dent, or could potentially make a heck of a dent in the obesity crisis, and that's worth it. All right, so I came to this idea for HealthyMe last year. I spent 6 months working in an obesity treatment clinic. So my patients were treated with phenterdiazepine, so they're treated with the pharma. And I had many patients who had failed bariatric surgeries, which is something that hasn't been talked about, failed after 18 months or 2 years, because if you do not have the behavior modification behind what you're doing, I don't care what it is, this is my opinion, I'm a behaviorist, it will not work long term. Will it work for a year? Probably. Long term, not so much, and there's a lot of statistics around that. I'm not going to bore you with that, but I saw over 300 patients within that time who were paying $70 a week for a 10-minute counseling session. About 50% of them got meds, 50% didn't. These were patients that worked at Kentucky Fried Chicken, and they're also bankers. This is in Charlotte. Bankers at Bank of America, attorneys. So these were people who, some didn't have a whole lot of disposable income. So I began to ask these patients, $70 a week for 10, 15 minutes of counseling. Why? What is it that you're getting out of this? Most of them said it was a sense of accountability, that they kind of knew what to do, but they needed to be kept on the right track. So they needed an infusion, if you will, of behavior modification. All of these patients, 100%, had been told by their primary care physician, you need to lose weight, good luck with that, see you in 6 months. Almost all these patients also had a comorbid condition. So I began to think, you know, there's a huge problem. Doctors are frustrated. They do not have any tools in their toolbox to address obesity. And patients are certainly frustrated. So I began to think, is there a way to scale the treatment of obesity? Is there a way to take what I'm doing here, make it better, amplify it, and make it accessible to everyone? And so I kind of looked at the trends in technology. Before this, I was not really a technology person, but I thought, well, if you're going to scale something, you have to use technology. So that's not my next slide, so let me just tell you. The problem is, let me explain the problem a little bit more. This is the cost of obesity per person. So now that the healthcare bill is passed and there's a lot of changes in healthcare, this cost, one for a male, one for a female, that's going to have to be shared with the healthcare system and with the patient. So this is a major pain point. Again, doctors are on the front line. They don't have a way to help. So I kind of looked at the technology. What's going on? Well, I mean, 91% of all people have a cell phone. So there's a delivery platform there. Think about the cell phone. Do you ever leave your house without your cell phone? No way. You don't. It's always there. It's personal. We kind of love our cell phone, right? So there's already a little bit of affect or feeling built around this cell phone. So the rise of obesity, it's there. The rise of the ownership of any cell phone, it's there. So the chances are that I can reach anyone who needs it with this device. Then I looked at texting. Is there a way to digitize health coaching? I mean, to really make an impact. How would I do that? Well, we launched in North Carolina, and I kind of looked at the ownership of mobile phones and specifically smartphones. Not a lot of people have them, but they do text. In fact, the largest growing segment of texting is in the 50 to 65-year-old range. Now, with the purple, this is what percentage of people who have a phone who surf the internet on it. Not even as high as texting. Besides talking via voice, texting is the second most utilized feature. Aha! You can actually have an intervention with a person with any cell phone. So this is great. This means huge access potentially. So we created HealthyMe to have these three components. Patient monitoring, self-monitoring rather. So those of you who address obesity on a day-to-day basis or understand it in your practice, you understand that if a patient isn't self-monitoring, there's really no way to be mindful in what they're doing and understand what they're doing. So that's the first tenet. Coaching is huge, and that's our specialty. Data is meaningless without some feedback about how to interact with that data, how to either improve it, what are the warning signs, etc., and importantly, integration back into the healthcare system. So my doctor friends know ODLs, what that is, observations in daily living. What if we could integrate that back into the healthcare system, specifically to the primary care physician? So within a 12-minute visit, a doc kind of gets a bird's eye view of what's going on between visits. So there's a huge, huge market blooming now in mobile healthcare. In fact, there's just an application launched where you can urinate into your phone and it tests for STDs. Do you know anything about this? I hope it's, you do it on a strip first because then the phone's toast. But anyway, I mean, really, I was thankful that I was married at that point. You don't need those kind of things. But anyway, kind of weird, but there's tons of apps for tracking, but think about apps. How many apps do you have on your phone? Tons. How many do you use? Very, very few. So once these apps, even the ones that are paid for, are downloaded, do you go to them? No, it takes another behavior to actually go to them. Also for tracking. Okay, a lot of us get excited about tracking and then 2 weeks later, not so much, right? A lot of wireless devices for collection, but again, data without context is not actionable. And education, by the way, health education, is not behavior modification. So here was our idea in terms of the coaching. Oh, also, doctors do, in fact, 88% of doctors surveyed in a recent PricewaterhouseCoopers survey said, look, I want my patients tracking. Gotta have it. Do I want to look at the data? Absolutely not. But I want my patients to participate in their own health care. Now, tracking becomes something totally different when you are being watched. So if you're tracking, even with a wireless device, or if it's self-entry, or however you're going to do it, if you know that you're being observed while you're doing the tracking, it takes it to a whole nother level. It makes the data actionable. And that's what we do at HealthyMe. How many of you guys have Pandora? Love it. Okay. So Pandora is a personalized internet radio service. So if I feel like Barry Manilow today, slap me, but if I feel like Barry Manilow, I can play Barry Manilow. So it gives me what I want to hear in a way that I want to hear it. That's what we do with HealthyMe. Our health coaching is going to give you motivation, education, feedback, and accountability in the way that you want to hear it and link it back with your healthcare provider for the ultimate accountability. So if I like Alice in Chains and Tool and Metallica, which I do, why would I want to hear something in Barry Manilow? I just wouldn't. So when we're talking about health coaching on a personal device, and for us it's SMS coaching, you have to resonate with people for long-term results. 2 weeks, the novelty effect wears off. And what our objective is to have something that really makes an impact at the 18-month point. This is what I call digiputics. Just to make sure I have it right, I have to refer to this. Digiputics is digital health coaching that is targeted, and it's got a few other unique characteristics. It is prescribed. We actually have physicians now who are in Concord, North Carolina, of all places, sitting across from a patient, writing a prescription for a mobile health program. Oh yes, so it's prescribed, definitely. Formulated and customized for each patient. So I'm going to get a completely different program as well as I should as a 56-year-old male. We tailor this intervention on 60 different dimensions. Obviously, stage of change is what we look for, demographics, basics, but is someone motivated by fear or are they motivated by affect or emotion? Is it a novelty-seeking personality? Does this person have a need for cognition? In other words, do they need statistics or do they need smiley faces and exclamation points? What is it? How do they want to receive these messages? Also, it is a dosed treatment. This is a treatment that follows the U.S. Preventative Task Force for intensive obesity counseling, but it's dosed appropriately for every patient, and importantly, it produces measurable results. We're able to pull data from the system, and I'm going to share some exciting data with you, really exciting, in just a second. Now, obesity is where we've taken our beachhead as a company because it's unregulated and it's a self-pay market. So our patient pays $25 per month for this because when patients go to the doctor, they want to be fixed. Obesity is one of those things where patients kind of understand that they're going to have to play a role in it anyway, and they're probably going to have to pay. So we believe that diabetes is another area that we can go into, smoking cessation. It's limitless because this is behavior modification. So any chronic disease that has behavior as a component, we can do this. And with the doctor's help. This is our current business model. Subscription model, 1, 3, or 6 months paid by patient. As we've heard the entire day, insurance companies do not pay for the treatment of obesity right now. We're not sure when they will, and we weren't about to wait. We had to do something now, and that's what we've done. The weight loss market is a direct pay market. Even though we're not in the weight loss market, we're treating obesity, so that's sort of where we're considered. And we're HIPAA compliant, so our data is between the doctor and the patient and no one else. We're not selling data. We're not utilizing data at all in a way to make a profit anywhere else. We are knocking on doors to get this product used. We're in North Carolina, South Carolina, and Alabama, and we have knocked on hundreds of doors, and being a medical device, I've never had this happen. I've been hugged, I think, 3 times by doctors. I'm used to being asked to leave. So it's a completely different experience. Physicians are very excited that they have a tool that they can actually use now. Here's our beta results. You might be very interested in this. We've spoken to over 100 providers. Now, before we launched HealthyMe, we conducted some primary market research with about 60 physicians via the phone, via our alumni network, all over the country, and we said, listen, is obesity a problem for you in your practice? All of them said, yes, of course. But what we didn't know is that all of them, 100% of these guys, were willing to try something, and that's kind of what we found in our beta. So we have 80 paying patients right now. And the thing about launching a beta where you've got paying patients is they complain early and often. So as a technology company, you can iterate like that. And that's great because if you've got a product that's free out there, you're not going to get too much feedback. So we've gotten incredible feedback. The system has really been created from the ground up with doctors and their patients interacting together. We have 50 prescribing physicians in North Carolina, Alabama, and South Carolina. And this is in Concord. We're not in Palo Alto or Boston or New York. We have a 65-year-old physician in Concord who is prescribing this for his patients. I don't even think he owns a smartphone. The average patient is losing 8 pounds in their first month compared to 4 pounds with generic programs. This is important. Our patients are interacting with our text messages 80% of the time at the 3-month point. Actually, at the 4-month point, that's a little better now. So if you've got something like a web program, that's going to get a 2% interaction rate at a month. That means Weight Watchers Online, that means whatever Merck is launching. Any of these compliance programs, about 2%. We're able to engage with our patients 87% of the time at the 4-month point. And we know that engagement with a program means the outcomes are probably going to be pretty good. Now, what questions can I answer? Thank you. Thank you.
What sort of texts do you send to your patients that gets an 87% reaction versus a 2-3% online?
Right. Just the fact that we have SMS texting as an adjunct to our web dashboard. So a patient can go online and they can actually try. I wish I had a screenshot. Is there any way we can pull up a screenshot on here? A patient is able to track anything, their mood, their stress, their sleep, their blood glucose, anything, their meds, in addition to managing all this. So there is an online component. But the kind of text to get an interaction would be our 3-way text. So I can text you at 2 because I know at 2 o'clock you're exhausted. You're about to go for the coffee, probably the Snickers, all right? Because the system's interacted with you a lot. And I'm going to say, you know what? Now's a great time for water. How many ounces of water have you had? And you text the system back 16. Not only does that 16 get captured on your dashboard and that we are doing data collection, the system, based on effective computing, will text you back in a way that you want to hear it. 16 ounces, are you joking? You need 32 ounces. Get up, get some water, and let's get going. And so those kind of texts are being answered where we're doing data collection on steps walked per day, weight on a weekly basis, mood, because we also want to see what kind of mood improvements are going on in tandem with the weight. And then what is the other one? Water, weight, and steps walked per day. So we'll send out a pedometer, and the patients are able to, well, first of all, they're texted in the morning on certain mornings. It's a dosage. Don't forget to wear your pedometer today. Because remember, wearing a device, even a wireless device, it's another behavior, right? So they're reminded to do that, and then we'll ask them, hey, how many steps have you walked? And you'll text 3,000. Really, well, your cohorts have walked 4,000, so what's up with that? If a patient is motivated by this social comparison theory, if they're not motivated by that, and if they need or have low self-efficacy, they'll get a text like, Mary, you can do it, 100 more steps, I know you can do it, in an hour, get up and walk around the office. So it's based on what motivates them. I mean, believe it or not, money and reward doesn't motivate everyone. Sometimes it's just recognition for a job well done. You know, let me tell you about a couple of patients we have. One patient of ours has lost 26 pounds in 6 weeks and can walk up 5 steps, just 5 steps, to work, unassisted now for the first time in 9 years. One patient has lost 23 pounds and has decided not to do bariatric surgery. One patient is 72 years old, lives in assisted living, and is using our program and has brought her blood sugar down from 200 to 111. So behind that results comes individual patients who have done amazing things. Hi.
I have a question about actually your product delivery. I've noticed it has involved a lot of partnerships, including the doctors, the patients, the software developers, and also like maybe the phone device companies and even the telecommunication companies. Can you talk a little bit about the relationships of your company with those players?
Sure. We don't have relationships with telecom. Our job now is we have a relationship with making sure the product is obviously deployed seamlessly in doctors' offices so that a physician can use this with the patient and then it reports back. So as far as telecom, we have a gateway that goes on any type of cell phone. We're not carrier specific. Of course, the channel partners that we can have going forward would be, Qualcomm, AT&T, et cetera, who are doing things like that. But the unique thing about us is that we don't partner with any other outside entity besides enabling the physician to deal with their patient. So.
Hi, great presentation. I think it's a great idea. One of the things that came to my mind when I was watching was the idea of this is not necessarily covered by insurance, and this is something that's coming out of pocket. So I was wondering if you had tried to investigate whether insurance companies would be on board with this, because if there's some trackable results, if there's better clinical outcomes as a result of this kind of project. You talked about one of the patients that brought their blood sugar down and, you know, losing weight and things like that, that they would be opening up to this kind of thing.
We have. We've talked to an insurance company, which will remain unnamed. Insurance companies are very traditional in the way that they do things. So they invest in some generic, I must say, wellness programs, which are online, et cetera. And the idea of a treatment is revolutionary to them in this delivery format. It's not face-to-face. So until there's a CPT code for that, they may not be open. We have started some discussions, and I think Humana Health in Florida is a very progressive organization that does allow for some of this. But at this level, they'd want to see something like a clinical trial. And I want to mention we have 2 clinical trials teed up. One at Harvard, or at Partners, for those of you familiar with the system, and one at UAB as well. So after a clinical trial, which is what they're looking for, something that's, you know, externally validated in terms of data, we might be more likely to get some traction.
Hi, great presentation.
Thank you.
We talked about market segments a little bit in the earlier panels. I was wondering, you know, if there's a significant, you know, well-differentiated market segment this caters to or is attractive to.
Yeah, and by market segment, we have 2. I mean, we're serving a multi-sided market here, which has been unique from marketing perspective. But we serve physicians and we serve patients. So when we developed HealthyMe, we thought, you know what, this is going to be a great program for a 50-something-year-old male or female executive on the go. They've just been diagnosed with diabetes. This is, you know, something they're going to engage in. It turned out that our patient population is from 40 to 60, female, 35% minority, and I think 50% has never tried a diet before. So what we went for was completely different than what we actually have. And in terms of physicians, we thought this would be great for primary care. Any primary care doctor can use it, et cetera. And now we're looking at the data on who's actually using it. And physicians who truly care about obesity in a way that they are ready to go. I mean, they are ready to shake their patients and say, you have diabetes, what are you doing? You have to lose some weight. And those doctors who really have a passion for it seem not to be a lot of female doctors or nurse practitioners. I mean, that seems to be their demographic breakdown. And a lot of them seem to be in rural areas as well. And so we think that's going to be a huge opportunity. Yes.
Hi, you kind of already mentioned your changing target. I was more curious about maybe the changing product, how things maybe have changed since you've started, either features you've gotten rid of or new things that you've discovered are working that you hadn't planned on.
Right. Well, wow, yeah, there's a lot. When you're talking about tracking and self-monitoring, it takes on a whole new level of importance when patients are going to track and they're going to have that data presented in front of a doctor. The tracking has to be seamless and it has to be right on. So our tracker, in terms of the food, the water tracker, et cetera, we have the most sophisticated tracker, bar none, on the market. It is based on self-entry at this point. But if you know anything about weight loss, when patients journal what they're eating every day, they're more likely to keep the weight off. So you really can't get around that. So the tracking element is one thing that we've really improved it. The product roadmap is exciting. I mean, we're going to add wireless devices. We're going to add integration with EMR. I mean, those sort of things are pretty easy to add, but the fundamentals have changed considerably, for sure. But ease ease of use and UI, if you know anything about digital, has been a huge priority for us. So.
Hi, Sloan. Thanks very much for the presentation. One of the criticisms you see of sort of these online tools and sort of smartphone-based treatment systems is that obesity and these metabolic disorders disproportionately affect those of low means and those in poverty. And so how would you address that criticism, and how do you think that your system sort of meets the needs of that particular segment?
Yeah. Well, this is interesting because we have physicians selecting. So patients aren't coming to a place and selecting the treatment for themselves. I mean, physicians are the ones that are introducing the program. And we do have a fairly large number of our patients who are Medicaid recipients who are willing to pay out of pocket for this. My belief is this, and our company philosophy is that a patient has to have skin in the game, period, in a discussion. So a lot of free programs are fantastic, and I'm very glad that they're available. But from our perspective, if you're asking for a lot of involvement from the patient, you're going to need to see that stage of change is achieved and that they're committed before they enter in the program for long-term success. So we've been able to address that by having the physician select the patient for it. And we have not found price sensitivity as being an overwhelming issue, because what we're asking is the cost of a premium copay. But our job, because we're developing this product, we have to deliver value for that patient, and we are driven to do it. So once we have a patient, we look to create a relationship with that patient that is like none other. So that a patient doesn't have to pay $110 to see an RD, $150 an hour to see an exercise physiologist, and to pay a behaviorist. They can get it all in one for one low price, and we deliver that value to them. So that's how we're pretty value-driven in that way.
How you doing?
Great.
There's obviously a lot of different components here with respect to you as a company, and also looking at patient outcome. Ultimately, what are you going to measure as success? Is it how many patients you have on the program? Is it based on how many people are losing weight or dropping blood pressure? What are your major metrics for success long-term and short-term, I guess?
And this is as a company?
As a company and as a provider of a service to patients, both sides of the mission.
That's a fantastic question, because I don't want our long-term success to be tied to weight loss. I think that that is an incomplete picture of what a successful program would be. If we're delivering value and if patients are renewing, we know we're doing something right. If I can ask a patient at 6 months, can you live without the service, and a majority of them can say no, then I've done my job. Now, what does that mean? We're still learning. Frankly, we're still learning about how to deliver value to 60 different types of people. And can you do it with one product feature, for instance? We think we're pretty much onto something with SMS texting. I mean, we've done extensive research around this, and it delivers a stickiness factor, and we text each patient about 3 times a day. It delivers a stickiness factor to where we have a 56-year-old female patient who had to be trained by her grandson to text, and she bought an unlimited plan because she couldn't live without the text. So, I mean, of course, we're looking for weight to come down, and we always love those stories where the patients are doing well. We also have a patient that's lost 9 pounds of weight in 6 months, but, you know, he's doing great. It's his first program. His physician's happy, he's happy, and his mood has improved. He came in a 1 on an average for a day. Now he's at a 6. I mean, there are all types of different metrics, and I think what we're trying to do is take a program, tailor it for an individual, rather than take a program for a population and drive it down that way. We're trying to drive it from the individual up. So. And if I haven't answered any question, my CEO, he's the business guy, I'm the CVO, remember? So I might go off the rails here a little bit. He's here to rein me in, so. Hi.
Hi. So kind of as a follow-on to the previous 2 questions, I was wondering if, I think you said currently there's only one product at one price point. So I was wondering if you had thought about, or if you're planning to in the future sort of figure out in terms of, you know, as you say, it's a very customized sort of thing, if there are certain segments of the population to whom the value, who might be willing to pay more for it, if you figured out sort of if there's going to be a HealthyMe Light or something that sort of has more
Premium
features or whatever. Yeah, exactly.
Yeah. Okay. First of all, I mean, with my CVO hat on, I say we're a treatment. So we are treating obesity as our first beachhead, but from a product standpoint, we're a platform for behavior modification. So I can take that platform, some of the same things I've learned from obesity, some of the same things, information we've garnered, and create something that adds value for smoking cessation, for instance. Because there's not a lot of stuff out there that there's actually effective long-term in that arena. So we can take that same platform, same algorithm, we have artificial intelligence built in, decision trees, et cetera, and we can build that out for different disease states. But it's all about how to add value for the physician, but mainly that consumer, and I don't know what that's going to look like for each individual one. But different price points, we're not at the stage yet where we're looking at different pricing points yet, but it's definitely something that we're going to look at. Yeah, so I hope I answered that directly. Hey.
Sorry, I'm just sort of raised hand here. So SMS is your primary communication vehicle, right, to interact with the patients. Recently, we have data plans which have SMS in it, so that's fine. But now, in a way, you're forcing the patients to get SMS plan, which may be $5, $10, depending on the carrier. So wouldn't it actually help to develop that relationships with the carriers, you know, to give discounts if a patient would want to join your service, or you would cover up the cost of SMS that motivates a customer to kind of join your firm. So I'm trying to understand why you don't have relationship with the telecommunication, or are there any future plans for that?
I can tell you one simple reason. We're a startup. We just started. So that before you do any of that, you have to have customer validation. You have to validate your business model, and you have to understand how to commercialize something. So we want to make sure we have the product right, the treatment right, and we're delivering value for both, in our case, the doctor and for the customer. Channel partners. I mean, we see an endless amount of potential channel partners, pharma being one of them, telecom being another one, et cetera. In fact, WellDoc has just partnered with AT&T. You might be aware of this for those of you who are in the mobile health space. So Qualcomm is another big telecom company that does partner with startups like us to kind of deliver those treatments. And that's what we look to do. But when you're in a startup, you have to make sure that your product actually works, actually is delivering value, and you have the right business model going forward. So that is absolutely something that we're definitely on and would love to do.
Hello. Maybe you partially answered the question, but my question is this business model scalable?
Yeah.
It's first question. So you said that it's targeted to a particular patient, but can you scale it to the whole population?
Yes.
And another one, do you have any competitors, and can potential or real, and can they copy your model and provide some kind of the same services?
We have no competitors. There's no one like us. Luckily, we do have competitors, because that's made us just, you know, ferocious about delivering value where other people can't. The mobile health industry is burgeoning. I mean, right now as we speak, there's a conference going on in DC centered around mobile health. So there's a lot of players on the market, et cetera, but they do ignore a lot of things. We're sort of a high-tech product playing low-tech. In other words, we're not going for iPhone, we're not going for the sensors, we're not going for all these things, because in our population, everybody has a feature phone and they can use our product. Okay, so we kind of appeal to a wide amount of folks. As far as, is it scalable? Yes, but as you're probably familiar with if you're in the entrepreneurship program, or even just the MBA program, is that before you scale it and commercialize it, you have to make sure that you have it right. So we're in that phase where we're ready to scale. And we're ready to say, okay, what's our distribution channel? Who are going to be our partners, et cetera. So we do look at it as a scalable treatment for obesity, and that's not easy to do, because you've got a lot of individual differences that you have to address when treating the disease. And so that's what we kind of sought to understand first before we scaled it. I mean, we have decision trees that are, okay, we're intaking everybody, they're going to fit into 6 buckets. And then as time goes on, they're going to fit into 12, into 36. Eventually, it's going to be a couple of hundred buckets as time goes on and people interact with the system. So the engine itself is incredibly sophisticated, and we're building on that.
I guess this is more of a comment. Maybe I'll make a question out of it. But I'm thinking of Informed Care, which is a group in Charlottesville, Virginia. Are you familiar with them? They went for the reimbursement step first. And so their interaction is twisted cable. They can see the patient and their diabetic patients that are government paid, Medicaid or Medicare. And they get a telecommunications interaction. So they got reimbursement. And they went to the physicians. They enrolled the physician to say, it stays your patient, but we're going to give you a piece of this. And we'll help them do better in terms of managing their diabetes. So I wonder about that. I also wonder about the fact that in other markets, and I mentioned it last night, that are much more SMS aware and inured to that. I mean, as soon as I make a bank deposit, I get an SMS that tells me that I made it. It would be interesting if this market were more potentiated to use SMS that might, track my purchases at the store. So it's telling me more about the kinds of things that I'm buying. And I'm wondering, I know you're a startup, but I'm just wondering about other markets that are already more SMS friendly, that also might be an opportunity to make your proof of principle. So somewhere wandering in there's a question.
Right, and I hope I can answer that. Yeah, definitely. I mean, there's a huge mobile marketing business around, let's say if we went to Target, and after you bought your prescription for a Bayetta, all right, you'd be pinged, hey, listen, a jump rope would go nicely with that drug. We happen to have them on sale, aisle 10, et cetera. And that's absolutely, a way that we can open it up and say, all right, Target, you've only got 1 million people that could use this. Great. And that's something that we're certainly going to do. Improving our efficacy, we're able to have lots of discussions with lots of people and become interesting to other people. But the telemedicine angle is very interesting. There's a company called Hello Health, Micah Health. It was mentioned. Did you mention Micah yesterday? We actually had a call with Micah yesterday, so it was very timely. But I've followed Hello Health and Micah for a very long time. They're on the campus there at Qualcomm, delivering care there. But they're able to find a way that you can see your primary care physician over the smartphone, which I think is incredibly cool. The way that we can do it here in North Carolina is a patient has to be 35 miles, I think, away from their physician to bill for telemedicine. So there's a distance component to that. However, I think you may have also had in there, or did you mean a revenue sharing model perhaps with a physician as well? Okay. We are completely open to a revenue sharing model. In fact, I came from medical device, so if I had to come in there and say, I'll give you $10 for every one you sign up, I'm used to it. But unfortunately, we can't, we haven't found a way to do that. And I'm open for suggestions. If any of you want to talk to me about that or would know something about that, a revenue sharing model is definitely what we're looking for with the patient and the doc, or for the doc.
Hi. Yes, so from the perspective of viewing this as a treatment, do you ever decide to actually discourage patients who might not be responding very well to this, just from the perspective of, you know what, you're really no longer getting the $25 worth out of this?
I wouldn't think of doing that.
Okay.
At the end of the day, we all, it's like a gym. I think I might belong to 3 different gyms in 4 different cities right now as we speak, and I'm not going. It's one of those things where we have a subscription model, and that's what we've built our business on. But there's another reason I don't do that, and it's this. If you're, from a psychologist's point of view, if you tell someone, you know what, you're just not cut out for that, who knows what will happen with that particular person. It might be so incredibly discouraging on an emotional level that they, I don't know, do something harmful to themselves. You just don't know how that's taken. But it's not up to me to determine when the patient isn't deriving value from my program. It's up to them. And so that's kind of how I leave it. So.
Thank you very much. I very much enjoyed your presentation.
Thank you.
Two questions. First of all, the type of expertise that you need in your team for this advice to be given, and there was a question about scalability that's very pertinent to this one. Yeah. And second of all, how did you get funding? Did you get any seed money or
credit cards?
Credit card?
Yeah.
Are you serious?
Credit cards and piggy bank. We're actually raising angel and VC fund. We did have a little bit of seed funding. We're in a company or in a startup called Launchbox, or an accelerator. So for those of you familiar, we're there and very happy to be there. But we're raising money on that. And to your point about the team, I should have mentioned this, but we have a couple of RDs on staff. We have a BSN or a nurse on staff. We have an exercise physiologist on staff and a behaviorist. And so what we're trying to do is, if you go and you're to your physician and they say you have to be on the DASH diet because you're hypertensive, what we're going to do is have the RD, who's already created several buckets for you, give you that prescription. So you're actually getting a prescription from that RD.
If you are to think of, let's say, kind of putting different qualifications from different fields in one individual that could properly address a person dealing with obesity, what would you choose?
If I could just pick one.
Just, for example, you don't necessarily need a doctor to do that, and you don't necessarily need a behavioral scientist to do that. So a little bit of each into one individual, right? What type of combination would you, from an educational perspective, would you choose?
If we're talking about the clinical treatment of obesity, I would have to go with a nurse practitioner. Would embody exactly what I'd be looking for, what someone would want in that. If we're talking about someone in the social sciences, I don't even know if I'd go with a psychologist. That's a very tough question. I mean, I'm not sure what I would choose. I mean, in my mind, we're dealing with very complex patients. I've got patients that at least have one comorbid condition. I have several patients that are on 13 different meds. So either a bachelor's level nurse or a master's level nurse, someone that can address medication compliance, diabetes management, weight loss, and a little psychology all in one, I think would be very helpful for something like this.
Thank you very much.
Yes.
Any other questions?
Thank you very much. Thank you.
So on behalf of the HSM program and the Healthcare Club here at Duke, you also get assigned Mike Krzyzewski basketball.
Excellent. I have 2 basketballs, you guys. Yeah. This is great. Thank you very much. Thank you.
Produced by Duke University. Online at duke.edu.